All right, we're now joined by Dr. Boyd, and per our last conversation, you mentioned how you work at the Suboxone clinic in Albany. First, I guess with background, does it have a specific name or is it attached to the hospital? How does that work?
Yep, it's a part of Albany Medical Center. It's the Albany Medical Center Addiction and Medical Toxicology Clinic. We see addiction patients as well as medical toxicology patients who have overdosed on other things.
And so, how does not to get too deep into the weeds, but how does Suboxone work? How does that process work for somebody?
So Suboxone is an opiate. It is absolutely a cousin of the opiates that we are trying to get people off of, but it's different in that instead of fully binding a receptor and getting somebody very, very high, very, very euphoric, and potentially very, very respiratory depressed, it only it fully binds, but it only partially activates the receptor. So if there's a different opiate in somebody's system, it can actually kick it off and replace it with a mellower medication that can reduce cravings as well as decrease withdrawal.
And so, it's something that you can take in a pill form, or it's also sometimes in like a filmy. I don't know what you would
Yep.
call it. How many different ways can you take naloxone?
So naloxone, buprenorphine,
Suboxone.
Suboxone.
Yeah. How do you
So
crack them all?
Suboxone is the brand name for a buprenorphine naloxone combination pill. And the buprenorphine is actually the active ingredient. Suboxone, the brand name, comes in either a tablet that dissolves under your tongue or a film that can dissolve in your cheek. So instead of swallowing it and going through your digestive system, it goes directly into your bloodstreams. There's several other brand names. There's the generic is available. There is also patches, injections, and implants available, although they're not as commonly used right now.
What would make somebody a good candidate to try to work at one of these, work with the clinic and try Suboxone?
Anybody who is interested in getting off of opiates should really consider contacting one of the many, many clinics or services locally to learn more about Suboxone. It's available through our clinic as well as Project Safe Point, Catholic Charities, St. Peter's Spark has appointments available. And if you are on heroin, your life is consumed by heroin. Addicts know that the thing that they're thinking about is the next time that they can get high. They can't function in society because they're using so frequently. Suboxone helps change that. It takes away the need to find drugs and replaces it with a medicine that can make you function normally in society. It's so very hard to get off heroin for patients, and Suboxone is just one of many, many treatment therapies that can be used to help. Ooh, I'm losing my audio somehow.
No, that was my fault. I pushed the mute. The puppies
Okay.
are playing underneath the table. What are some of the success stories that you've heard, or you've dealt with on a personal level that you've seen people go from, I'm assuming, rock bottom to then back to a functioning life?
And in our clinic, we have patients in every stage of recovery and some in certain stages of relapse. And I can think of one particular patient who we met in the hospital and was just at her wit's end. She was trying to get sober and trying to get sober and just couldn't. And every time she would have a period of sobriety, she would relapse. And we worked with her for years, and she had good weeks and bad weeks and good months and bad weeks and good weeks and bad weeks, good months and bad months. And within the last year or so, she made a real breakthrough in her life. And just when she comes into clinic, I see her and just she looks healthy. She looks happy. She has a part-time job. She has her own apartment. And 3 or 4 years ago, she didn't think she'd live to see today. And now she's really starting to live her best life. And we can see that again and again and again. And Suboxone is just one of those tools that makes it easier to get off heroin, get off any opiates.
And I'm assuming, like any form of recovery, it doesn't work for everybody. That's just how it's going to, that's how it works, right? Is it might work really well for someone and you hear the success stories, and then for other people, it might not be the solution that they were hoping for.
I have seen a surprisingly large number of patients who do really, really well with buprenorphine, but you're right, absolutely. There are other options in terms of recovery, and Suboxone is a medication. It's just one part of therapy. Sometimes people need inpatient Narcotics Anonymous meetings and family support and support of your friendships that'll get you through. Like, one of the most harrowing experiences that any person can go through is trying to get off these narcotics.
I know I've heard throughout the years, that there is, to play the devil's advocate when it comes to Suboxone, that it's, it's enabling, or it's like you said, it is still an opioid. What would your message be to someone who might have, second guessing if it's a possible solution?
I have this conversation with my patients all the time. When I have a patient and they want to be on Suboxone, or they've successfully transitioned to Suboxone and now they feel like it's a crutch, or they feel the social stigma, or they feel the social stigma associated with Suboxone, and they want to get off of it, I tell them addiction is a problem with your receptors in your brain. And once you become addicted, your receptors are different. Just like somebody who has diabetes, their receptors in their body are different. So if you gain weight and stop exercising and you get diagnosed with diabetes, your doctor might start you on a medication, and that's okay. And for some period of time, you might be on this medication. And then maybe one day you decide you're going to lose the weight. You're going to start running marathons. You're going to start exercising. You lose the weight and you might get off the medication, or you might stay on the medication because you still have diabetes and your receptors are still changed. The same goes for Suboxone. Suboxone is a treatment for a disease. Addiction is a disease, just like diabetes is a disease. And being on medication to help fight your disease is not a moral failing. It is you trying to get healthy and be the person you want to be.
Very well said. Is there anything that I'm missing when it comes to Suboxone?
So Suboxone is one of many medication treatments. The other most common medication treatment is methadone. In the Capital District, there still remains a very long waiting list to get methadone. And methadone and Suboxone are similar, and they both bind those same receptors. But methadone is different in that it can have some more side effects. Most patients need to go to methadone clinics on at least a daily basis, where our Suboxone patients tend to come once a month. That can get spread out they come once a week, which can get spread out to about once a month as the patients stabilize. Suboxone has a maximum dosage. So if you take 3 tablets per day, you're not going to feel any difference really between 3 tablets a day and 4 tablets a day and 5 tablets a day and 6 tablets a day, because once you get up to the 4 tablets a day, because it binds fully and only activates partially, it doesn't really do much more. And one of the amazing things about that is, if I decide I want to overdose, or I take too many, or somebody gets into them that shouldn't, it's less deadly. So you can overdose on Suboxone and be less likely to die as compared to other opiates, including methadone. Methadone does have some side effects, especially cardiac side effects. And like oxycodone, where a patient might get started on 10 milligrams and then need 20 and then need 30, which is kind of the natural history of oxycodone, same is true for methadone. So patients will start on 30, then they'll need 40, then they'll need 50, and you'll have patients on really high doses of methadone, and you're starting to see the side effects of methadone, things like somnolence. It's no longer working effectively. We're not seeing that with Suboxone, so it makes it a much, much safer medication. Suboxone can be a little bit difficult to start on, because you have your receptors, they might have some opiate on them. If I give you Suboxone right away, it's almost like giving you Narcan. It's going to knock the opiate off of your receptor. So you have to be in at least some form of withdrawal before you can start a strip of Suboxone. And a lot of my patients come to me, there is Suboxone, people are selling it on the streets. And my patients will come to me because they buy it on the streets, they start using it, and they realize this is their pathway to sobriety. But if you are on heroin, you take it, it will put you into terrible, terrible withdrawal if you don't do it carefully. So it's something that definitely should be medically supervised in some way when somebody's starting out on Suboxone.
Do you have any statistics when it comes to your clinic in Albany? Like how many people are being seen on a weekly or a monthly basis, how those numbers have changed, anything like that?
I don't know the answer to that question. I could definitely get you that information. Um, we have clinic, well, we have clinic 3 days a week. And from when we started about 10 years ago, and we are just increasing in size and number of patients. We have 1 full-time nurse practitioner and 5 part-time docs that work there. So we do have availability to expand as our patient population expands.
That's awesome. That's going to be my next question. Is there like a waiting list when it comes to Suboxone or
Right now, not really. There's not much in terms of a waiting list for our clinic. Places like Project SafePoint and Spark, a lot have walk-in hours, because it can truly, not only does it save the lives of a person who's actively using, and we all know how dangerous that could be, but if you're patients who are actively using injected opiates, they're at risk for HIV, hepatitis C, infections, and switching away, getting away from injections. Any harm reduction we can do is going to limit the amount of patients who are sick. So it's going to just help us, help people get off drugs, but also it's going to reduce the number of patients in hospitals, reduce the HIV load in our communities. So there's a lot of different options, but right now we don't have a waiting list, and we are able to see patients within about a week or so. Same goes for Project SafePoint. The one thing about our clinic that's different than some other clinics, unfortunately, we're still building, and we don't have a lot of the therapy, like we don't have an attached psychiatrist or psychologist as does say Spark or Project SafePoint. So that's the one limitation of our clinic that we're working on. And we hope to have kind of expanded capabilities in the future.
You've kind of already mentioned that, for someone to start Suboxone, they need to be at some sort of stage of withdrawal. But does it work for like anybody could qualify? You could be a teenager, you could be in your 60s. There's no like requirements when it comes to who is a right fit for this recovery?
Absolutely. There's I cannot think of any contraindications of Suboxone when it comes to getting somebody off of heroin. So the risks of Suboxone are 1,000 times less the risks of heroin. So in that way, unless you are allergic to one of the medications, there are no contraindications. It is off-label use for pediatric patients, but unfortunately, we have pediatric patients who are using heroin, and they are absolutely able to use this medication. And we do have patients up into their 80s on Suboxone.
Wow. Anything else that you think you want to add or would be worth mentioning?
Let me see. I'm sure I have a lot. There is a stigma attached to Suboxone, but there shouldn't be. The people that are using heroin, this isn't 20 years ago. There are teachers, there are mothers, there are sisters, there are brothers that are using heroin. It is our families, it is our friends. It is a different world than it was. We should definitely embrace people who are interested in recovery. There's so many options out there. All you have to do is Google Suboxone near me, and you can find a provider and make some phone calls. Anybody who is a user of opiates or knows a user of opiates should have Narcan. I have a Narcan in my car. I have a Narcan in my bag just in case. And again, you can Google free Narcan near me, and they will actually just send it to you. You can pick it up at a health department. You can get it at any Rite Aid or CVS, and insurance pays for it most of the time.
Awesome. Dr. Boyd, thank you so much. I appreciate it as always.
It is absolutely my pleasure. And please, we got to stop the stigma. We got to get people into recovery.